So when the federal government established funding for the national centres in HIV all those years ago, one of the key roles of the national centres was to produce information about the course of the HIV epidemic and its underlying features, which would help evaluate and guide the future of policy. And the two centres that are represented in this next part of the session, which was once the National Centre for HIV Epidemiology and Clinical Research, and now the Kirby Institute, and it was once the Social Research Centre with a similarly difficult name, but also transformed its name more recently, were given the tasks of providing reports on epidemiological and behavioural information related to the HIV epidemic. Since 1997, we've released twin reports, not just about HIV, but also about bloodborne viruses in general and sexually transmitted infections. And that's become a regular feature of our annual cycle of information production in the strategic environment of Australia. This year, because of the conference, the international conference being held in Melbourne, and the plan was that we were going to have our regular annual surveillance reports released later in the year, but there was a need to release the HIV information prior to the conference. So we've produced this year as a one-off special HIV-specific bulletins that cover the situation for HIV in Australia in relation to the epidemic and related behaviours. So I'm pleased to first invite David Wilson, who's the head of our Surveillance and Epidemiology and Public Health program, to present the epidemiology and surveillance side of HIV.
Thank you, John. Here with me I've got our supplement of the HIV data for Australia. This is in a report out of the auditorium near where you registered this morning, so you can receive a copy there as you leave today. I'm going to do a tag team effort with Limin Mao, so she's going to join halfway through. So I'm going to present HIV data in Australia. This curve represents the number of diagnoses of HIV in Australia year by year since the epidemic began. What we can clearly see is that it's been on the rise over the last 10 to 15 years. There's been a 70% increase in the number of HIV diagnoses since 1999. In the last calendar year, we had 1,236 cases of HIV. That's very similar to the level in the previous year, and that's, these sustained levels, are the highest we've had in about 20 years. Now, these are just diagnoses. They're not incident cases necessarily. So one of the first questions we ask is, are these diagnoses representative of incident cases, or is it due to increases in testing? This slide shows us the median CD4 count at the time of diagnosis and the proportion of cases that are diagnosed with a CD4 count less than 350 or less than 200 cells. The CD4 count is an immunological marker. It's an indicator of the duration of time from infection to, in this case, to diagnosis. What we can see here is that the trends in the CD4 count have remained very stable over this entire 10-year period. That suggests that despite increased initiatives to further increase testing, there's no evidence that there has been a shift in the distribution of earlier diagnosis, and it suggests to us that the diagnosis is reflective of incidence and not necessarily testing. There is variation in the rate of HIV diagnosis across the states and territories in Australia. So there are a lot of lines there. What I'll just point out is that in no state or territory has there been a declining trend in HIV diagnoses over the last 10 years. New South Wales has remained relatively stable. Victoria has increased over that period, effectively catching up to the level that has been in New South Wales over this entire period. Queensland has also increased and started to stabilise. Most other jurisdictions have had increasing towards potentially stabilising levels, but there's been no decreasing trend. For the first time, we are releasing data on our first estimate of the HIV care and treatment cascade in Australia. These estimates will be refined in future as we put more effort into monitoring each of the indicators in the cascade. But there are a few points that I'd like to highlight in our best estimates to date. Historically, we've had about 35,000 people diagnosed with HIV in Australia, and we estimate that about 10,000 of those have died. Our best estimate is that there is about 14% of all people living with HIV that remain undiagnosed. Clearly, we want to reduce that number, but that proportion is around the lowest in the world. So when we consider the number diagnosed and our estimate of those undiagnosed, that indicates that roughly 27,000 people in Australia are currently living with HIV. Of those 27,000, we estimate that about 17,000, but there is some variation around that because of various data measures, and we're going to improve that in future years. But around 17,000, we estimate, are on treatment and have undetectable viral load due to effective therapies. That represents, across our plausible limits of minimum to maximum estimates, of about 47 to 75% of all people living with HIV have undetectable viral load. That's a remarkable effort. Putting that into perspective, in the United States, it's around 25 to 30%. So we're doing substantially better than most parts of the world. I'm not aware of any country that has higher levels than where we are now. But we estimate that about 54 to 87% of all people diagnosed with HIV have undetectable viral load. That does, of course, suggest that there is room for improvement. That we can increase those percentages. Over the last 4 to 5 years, the distribution of modes of acquisition of HIV have remained similar to what they have historically. Most of HIV in Australia continues to affect gay and other men who have sex with men. Male homosexual exposure is the dominant mode of transmission in Australia. I'm now briefly going to present some data related to each of the key affected populations. Firstly, gay and other men who have sex with men. Historically, almost 80% of all HIV diagnoses have been among this population group. Over the last 4 to 5 years, it's been about 70% of all cases among men who have sex with men. Among gay community-attached men, we estimate that the prevalence of HIV is about 8 to 12%. So that is clearly a key population group in which which HIV is highly affecting. I'm going to hand over to Limin to talk about some of the behavioural data we have related to this group.
The next 2 slides, I'm going to talk about particularly behavior surveillance from our gay community periodic surveys. So the first one is looking at HIV testing among those people who are not HIV positive in the last 12 months. And you can see that it's over the last 10 years, it's very stable, around 60%. And also this data is consistent with the previous David's presentation about people when they diagnose, when they having the HIV diagnosis, the CD4 count is stable at that time. So, but with the New South Wales in 2014, with the uptake of the rapid HIV testing, we see the first time in Sydney that among gay men there is an increase, a significant increase in terms of annual HIV testing. So later on we need to monitor that. The second slide shows you unprotected anal intercourse among gay men, particularly those with casual partners. And this is quite a contentious area. You can see that in the last 10 years, with the increasing uptake of antiretroviral treatment, unprotected anal intercourse among all gay men has increased from around 30% to 36%. This increase is particularly seen among HIV-positive men with casual partners. In terms of HIV diagnosis among gay MSM or among MSM, you can see that the behavior surveillance actually quite consistent with the diagnosis, and in a way, the increase in unprotected anal intercourse with casual partner precedes the increase in HIV diagnosis, showing that behavior surveillance can be a good role in terms of pre-warning. Now I'm hand back to David Wilson.
Thanks, Limin. Just looking at the other key affected populations. Among people who inject drugs, HIV remains at very low levels with a prevalence of only about 1%. So very low compared to most other regions. Testing remains relatively high, and risk behaviours are relatively low. There is virtual elimination, virtually no HIV among female sex workers, and relatively high testing rates, in fact, very high testing rates. And we have virtually we have virtual elimination of mother-to-child transmission with an average of only one case of mother-to-child transmission per year in Australia. In Aboriginal and Torres Strait Islander populations, the rate of HIV is slightly higher than it is among the Australian-born non-Indigenous population. What we can see is that over time, there's been a consistently greater rate among women that are in the Aboriginal and Torres Strait Islander community compared to the non-Indigenous population. In just the last 2 years, we've started to see a deviation in the male population, so we need to look at that quite carefully in the coming years. In particular, it's important to note the difference in the mode of acquisition of HIV between the Aboriginal and Torres Strait Islander population and the non-Indigenous groups. In both groups, male-to-male sex is the dominant mode of transmission, but there is a greater proportion of infection due to injecting drug use and heterosexual contact among the Aboriginal and Torres Strait Islander community. So there are our data for HIV in Australia. We have seen an increase in diagnoses. We suggest that that's possibly is likely to be an increase in incidence. We've seen that it's in unprotected sex among gay men has been one of the possible reasons for that increase. However, I'd like to put everything into perspective just as I finish up here. Australia has very low levels of HIV compared to most countries around the world. This graph shows you HIV prevalence in Australia compared to other selected countries in our region of the world and compared to other high-income countries. You can see that Australia has very low levels. Also, just to put it into perspective, this is a paper that came out earlier this year in Current Opinion in HIV/AIDS. This review paper looked at 28 high-income countries. And they looked at the diagnosis rates and found that Australia has, it was the second highest country in terms of actually the lowest number of late diagnoses. But what this review showed is that for every 100 cases of HIV in the country, you could expect 4 diagnoses each year. That was a median average across these 28 countries. And putting it into perspective in Australia, we have very effective treatments. We're keeping people alive for a lot longer, so we're having a growing population of people with HIV. If we look at our 27,000 people with HIV, and we have about 1,200 to 1,250 cases per year, that's about 4.5%. So we're tracking about where most other countries are that are comparable to us in terms of high-income countries. So the rate of increase in our diagnoses is not unexpected, and it's largely a success story due to the fact that we're keeping people alive for a lot longer. So we're tracking about on average in that respect, but in perspective, we've got much lower levels of diagnoses and prevalence compared to most countries. And we'll leave it there.